Hi, welcome back to part 2 lecture of chapter 3 for your pharmacology class. So I'm going to review this slide again just in case you took a break and decided to do the lecture on a different day. We were starting with schedules and we were talking about Schedule 1, which is highly addictive. There's no acceptable medical use. An example of this is heroin. It's illegal to process, distribute, and use, and the only time it may be used and approved is in a carefully controlled research facility. Looking at Schedule 2, there is a high potential for physical and psychological addiction. A written prescription is required and no refills are allowed. Examples of these include cocaine, Ritalin, and oxycodone. Schedule 3 are considered to be moderately addicting, leading to limited dependence. 5 refills every 6 months is the maximum refill that can be given. Many are combinations of less addictive medications with a small amount of narcotic included. And examples might include hydrocodone or Tylenol 3. Prescribers must sign a prescription written by an allied health professional. So they must have that signed prescription, and they can't just go in and send it electronically and go into the pharmacy. So what that means is this is a prescription pad that has to be signed, and the refills have to be written on that. So on Schedule 4, this is a lower potential for abuse. The prescriber must sign prescription written by allied health professions. So again, this is a signature. It also, though, can be faxed and phone. So you can also have it called in that's authorized by the prescriber, or you can fax that in. So not only a signature is required, but the fax or phone order is allowed and permitted. And again, we see the limitation of 5 refills in 6 months. So some of these might be Ativan, Valium, Xanax. Schedule 5 is the lowest potential for abuse. So over the counter in some states requiring signatures and identification of patients. We have this in California. An example of this might be if you were going to get Sudafed and you wanted to get that over the counter, then you are required to show your ID and sign that it was you. And basically, in this case, it's a safeguard because some of these medications are also used to make synthetic drugs such as methamphetamines. Some examples might be cough suppressants with small amounts of codeine or diarrhea preparations, as well as, like I said, the Sudafed over the counter. In all offices that contain controlled substances, there's an inventory log that's maintained and it must be checked daily. Records are kept for 2 years, so you have to keep all the records on file in the office for 2 years, and they should be kept in a double lock safe cabinet. If they're lost or stolen, the DEA Form 106 must be filled out by the prescriber that holds the registration number. And all of these drugs, you must follow agency policy for disposal. So again, it's important to remember that if there is lost or theft, that not only is there a form that's filled out, but also a police report should be filed. And whenever you go into the office and you're working in whatever office you end up working in, of course, you will learn and follow their procedures on this. So we consider slang as street names. So drugs on the street have different names and they're slang names. They're not typically the same names that are used for the drug. So both legal and illegal drugs have slang names. Some substance abuse issues our drug addiction is compulsive. It's maladaptive dependence on a drug, and the dependence can be physical and psychological. So the person who's abused can be physically, like chemically addicted to it, as well as their brain just may be telling them that, for example, if they're addicted to a pain med, that as soon as that pain med starts to wear off, their brain is telling them, not only their body telling them chemically, but they realize the signs and symptoms. So psychologically, they start to have those withdrawal symptoms along with the chemical symptoms. Drug tolerance is the progressive decrease in a drug's effectiveness after repeated use. So when somebody is abusing drugs, they tend to build up a tolerance. We also see this, another example of this would be in alcohol, where it starts to result in the need for higher amounts or higher doses of that drug in order to create the same effect. Habituation is the progressive psychological dependence on a drug. And again, the root word of habituation is habit. So you can think of this as this becomes a psychological habit that the body is now psychologically dependent on that drug. Preventing substance abuse is always a challenge, not only in the healthcare area, but I'm sure that many of you have family and friends that have substance abuse issues. So it's important that we always know local resources, what's around us that can help us or that we can give to the person that we're suspecting has substance abuse in order to try to get them help. If you notice that a coworker is impaired, you must report it to a supervisor. And do not cover up inappropriate behavior for somebody because, again, if this is related to substance abuse, we want to have that intervention as soon as possible. So resources can include support groups, employee assistance programs, AA, known as Alcoholics Anonymous. If the impaired person has a license, the supervisor should report the behavior to the State Board of Medicine, Nursing, or other appropriate licensing agencies, and the practice may be limited for a period of time. Again, this is a really big deal, especially if they hold a license. And yet at the same time, it's so important that they get the needed intervention if there truly is substance abuse going on. Abusers stand to lose families and their jobs, and sometimes they lose all of this before they're willing to get help, and it's really at their time that they choose to get that help. So covering up abuse is not helping the situation. If you know somebody is abusing a substance, covering that up, even though it may feel like it's helping a situation because you don't want them to lose their job or to lose their license or have it restricted, in the long run, just remember it is not helping the situation, because the best case scenario is that we're able to intervene and continue to give support. And obviously, when we talk about safety of ourselves and our patients, if we have an impaired person that's working in a healthcare facility working with patients, obviously this can be a high risk for potential for danger for our patients as well. So here are some signs of possible abuse. If somebody's frequently late or absent from work because of an illness, if they're irritable and defensive or withdrawn, if they make frequent mistakes, they don't keep scheduled appointments, they have difficulty working with many staff members, and these are just some ideas. It doesn't mean that if somebody is exhibiting these signs that it's necessarily for substance abuse, but it's things to be aware of and put together if you have any suspicion, as well as sometimes you'll start to see their behavior change and they relate to patients unprofessionally. You can also note physical symptoms, changes in appearance where they start to not take care of themselves and they don't keep their normal hygiene. So these are all possible substance abuse signs. Again, it doesn't mean that one or two of these signs means that, but if you're putting it together and suspecting, then you want to start to kind of keep documentation of that and really, talk to that person too and try to help them. So here's comprehension checkpoint 3. The DEA assigns controlled substances to one of 5 schedules based on their, what is it based on? Tolerance level, abuse potential, number of prescriptions allowed, or ability to cause overdoses. If you said B, abuse potential, you are correct because controlled substances are assigned according to their potential for abuse. This is our last slide of the lecture. I hope that you learned something new, and if you have any questions, use the question and answer board, or you can also message me either on Remind or on my email. Have a great week, and I'll see you in class. Bye-bye.